So up till now, this afternoon's focus has been on disease-modifying therapies, things that we do that affect the underlying course of the disease itself. But although that's critically important, it's equally important to address the symptoms that people have with MS, and there are a whole variety of these, as many of you know. And our next speaker, Dr. Aliza Ben-Zacharia, is going to address that subject. Aliza is one of two nurse practitioners at the Corinne Goldsmith Dickinson Center. I've often said that the touchstone of a comprehensive MS care center is the skilled nurse, or in our case, nurse practitioner. And we're very fortunate to have two very talented nurse practitioners. Dr. Ben-Zacharia is a doctor, but unlike the other kinds of doctors on the program today, aside from Dr. DeLuca, she's not an MD, but a doctor of nurse practitioning. Aliza earned her Bachelor's of Science in Nursing from the Hebrew University in Jerusalem, and then a Master of Science in Nursing from Hunter College Bellevue School of Nursing, and then her nurse practitioner certificate from Columbia. In 2010, she was awarded a doctorate degree in nursing from Case Western Reserve University, focusing on neurological nursing education. Aliza has been very, very active with an organization called the International Organization of MS Nurses. She's been the chair of their website committee, and she's been widely sought after for educational programs in the field of MS nursing. So, Aliza.
Thank you so much, Dr. Miller. So, yeah, I think I definitely agree. You've heard a lot about treatment of MS, the disease itself, but already Dr. Miller mentioned it. Symptoms management is equally important. These symptoms really affect your life, your daily life, and I think many of you can attest to that and tell us about symptoms that you have experienced throughout your life course. So I think we'll talk about symptoms, mainly briefly, because you'll believe me, when you talk symptoms, you can talk about symptoms for many, many days, maybe even weeks. You talk about one symptom and define the symptoms and address its management and what to do and how to address it. Doesn't fit 35 minutes, but I will try to talk in general about symptoms, and I chose few specific symptoms that I think are very, very common in MS. And if you have questions about different symptoms that we did not address, we'll have time during the panel to answer these questions. So what is the symptoms? And I think many of you can answer this question maybe better than I can. I think when you say symptoms, it means something that you experience, something that you can tell us about, that you can describe it. It can be new symptoms, and it can be something that's ongoing throughout many, many times. And we'll talk about those. I believe Dr. Katzand and Dr. Fabian earlier talked about relapses and relapse management, and that's treatment, it's for new symptoms. So I'm going to pass that. And my focus in this talk, it's really about those chronic symptoms, ongoing symptoms that you experience from time to time, and they may fluctuate over time. So this list, as you can see, and you'll see a few lists here, divide into three: primary, secondary, and tertiary symptoms. So those primary symptoms are the symptoms that really are a direct result of the disease itself, of the demyelination and the nerve loss in the central nervous system, in the brain, in the spinal cord, or around your optic nerve. So it's, again, direct relations. The secondary symptoms, however, they're results of the primary symptoms. So, for example, you can see if someone has weakness, the secondary results may be false. Or if someone has some urinary retention, secondary results can be urinary tract infection. And then going to tertiary symptoms is those symptoms that are a result of the disease process. Some issues with relationship in the family, effect of your job performance. So it's more of the outcome of the disease itself. So again, I think in the end of the day, they start with the disease itself, but what's causing what? It's almost sometimes can be a chain reaction, and we all want, really our goal in managing, well, you see later, it's stopping that chain reaction, identify the symptoms immediately when it appears. It's critically important, and then addressing it immediately. So, and as you can see, I think I would like to pay your attention to the first bullet there. Symptoms can vary from patient to patient, and even within the patient themselves. Sometimes you come to me and say, you know, there are days that my walking is different, and there are days it's better. So there are lots of fluctuations. So symptoms vary within the person, as definitely in between patients. I can tell you, based on my experience, there are no two patients alike with MS. Your presentation of symptoms is different. How you address them, how you manage the symptoms is different. Your whole approach to being open and accepting different trials is different. So accept that. You're unique, and that's who you are. So again, the goal here is to hopefully stop or control those primary symptoms that you see here, that they would not end up and results in those secondary and tertiary symptoms. This is a list of many, many symptoms, as you can see. An MS specialist, very prominent that many of us know, Dr. Gary Birnbaum, said the sentence below: treating the many symptoms of MS is as difficult a challenge as modifying the disease course. And it's really true, because, and you can, again, describe and tell me many stories about your experiences that you'll see that sometimes it's pretty challenging managing your symptoms. And they're important because they're affecting your daily function. Again, of course, controlling the disease is important, but definitely also addressing the symptoms. Another important thing is the relationship between the symptoms. They interrelate to each other, they relate to each other, and they interact with each other. For example, in these symptoms, as you can see, if we can start from fatigue, let me see if I can work this out here. If we can start from fatigue, and then if you're not interested, you're tired, you don't want to do any activities, your mood, you feel down, you're less happy, more sad, because you cannot do the things that you wanted to do all the time. And then this can probably lead to some inability to concentrate. You heard Dr. DeLuca's talk. So some issue, paying attention because you're depressed, because you're too tired. And then that can lead to some disinterest. You're interested in many, many things. Social events in the family can go down. And then it can lead to, what is there? Let me see what's there. Not going to work, thank you. So as you can see, it's a cycle. Sometimes one thing leads to another. And that's what's really, really important, to treat the first symptom. Sometimes it's hard to know what starts, it's the chicken or the egg. But I think with your help and working as a team, we need to address what came first. What was the first symptoms that need to be identified here to really treat? For another example, if you look at spasms and someone has really annoying spasms and it wakes you in the middle of the night and then it interrupts the sleep and then you end up with fatigue. So you can see that relationship in that symptom. So always important to identify the first symptoms if it's easier enough to do and manage that one before you get the second and the third and the fourth symptoms. Very often, I must tell you, I think it happens with newly diagnosed patients. I have one primary physician who work together, and the patient goes to him and says, "Oh, I have this." And say, "Oh, go to the MS specialist. It's MS related. It's not my territory." And then the patient comes to us, and I speak with the patient, see the patient, and say, "This is really not MS related. Go back to that primary doctors." And I'm sorry, sometimes you probably feel like we are sending you back and forth here. But I think very often when you have symptoms, you think it's MS because you have MS, but it can be related to many other general issues, not necessarily MS. I have an example here. I have pain in my right hip, and it affects my walking. I saw my general doctor, and he told me that it is MS-related and to come see you. Again, when you have joint pain, not necessarily. Sometimes when you walk differently and you use a device or a cane, you can affect the joint. However, sometimes it can be just a simple hip joint pain that has to be addressed differently. So it's interesting. And sometimes, I must say, it can be a combination of factors. It can be that sometimes had some joint issue that led to problems that may be seen as MS, like walking difficulty. So sometimes it's hard to really, I must admit, tease out where is the cause? Is it MS related or not? I put some example, as you can see in the next slide here, looking at some things that can be MS-related and some not MS-related. So nerve pain, definitely, if you describe, and many of you probably experience like crawling pain, increased sensitivity in the arms, pins and needles sensation, tingling sensation. So that's what usually nerve pain feel like, or electrical sensation. As opposed to a knee pain, it's a pain. It's a pain. And, you know, it's like, so it's important to really describe it to us. And always we ask you, so tell me how it feels. And sometimes it's important to, like, prepare a list before you come to see a clinician. Or either weakness in one leg. More so in MS, you see specific weakness in one area. So the leg is weak, the arm is weak. It's not a general weakness. And you see on the other side, it's a general weakness. And that's when you general weak all over, it's usually not MS related. Sometimes it can be a viral illness like a flu. So again, or either fatigue. Fatigue is a very common symptom, which I'll talk in a few minutes about. It's in MS, it's really total exhaustion, really, really fatigue, tiredness, without any relation to any activities. I think as New Yorker, we do so much, we're all tired at some point. But this is not it. This is an overall fatigue sensation, really an overwhelming fatigue. As opposed to fatigue that we all have, as I just mentioned, when you do extra activity, or when you're very busy and the pace is quick. So that's really different. This is not absolute, as I mentioned on the bottom. Sometimes, again, you can have combination. Very often, going back to those MS symptoms, patient will ask us, I have some spasms. Where is it coming from? I have fatigue. Where is it coming from? I want to know exactly where it's coming from in the brain or the spinal cords. And not always symptoms or signs of the disease correlate with location. But sometimes we can tell you, okay, the example that you have here relate to the brainstem, the box in the brain, in the back of your brain, that you can have double vision, which is a symptoms, and then movement of the eye that can be a sign. A sign, by the way, is something that we see when we do the examination, and as symptoms, it's something that you report to us, something that you feel that's happening to you. Another slide to show the location. So again, not always we can put it together and say these symptoms come from here in the brain or the spinal cord, but sometimes we can. Like, for example, optic neuritis, we know it's inflammation on the optic nerves. Or either if you have cognitive changes, it's come from the front of the brain. Or any bowel or bladder issue usually come from the spine. Or their meat sensation, as you know, when you bend your neck forward, sometimes you have an electrical sensation going down. That's coming from the spinal cord. So sometimes we can give you an idea where we think it's coming from in the central nervous system, the brain or the spinal cord. So let's talk about management of symptoms and what are the goal of treating the symptoms. There is no question when you treat the symptoms, you improve quality of life, and it's really important to remember that. And I think you experiences, and I think as a team, and really important to really emphasize the role of a team here, because we have physicians, we have nurses, we have social workers, we have some psychiatrists outside of our main center. However, it's a multitude of specialists that address the symptoms. But it's more a discussion between us and you, because it's important to discuss. And not only you as the patient, also the family, your family as well is important. Spouse, kids, whoever is part of the family or friends. And again, your perception is really the importance here. How does it affect your life? How does it affect your daily function? So really, really important. Because quality of life, it's really the main thing what we do here. We want to make sure that your lives are better with controlling the disease and controlling the symptoms of MS as much as we can. There are many approaches to symptoms management, as you can see. Some of them are non-pharmacological. We'll talk a bit about them. Rehabilitation, exercise that was mentioned earlier, which I'll definitely mention as well. Some complementary medicines that people use, which briefly I'm mentioning. Again, if you'll have questions later on, we can answer them. And then psychology and psychological support. So, before I go into specific, I wanted to really mention something really, really important here. I think every patient and family together with the patient has to focus on your own illness and your own health. It's really important. Some of our patients look always at the neighbor and the friend. You know, the grass looks greener, correct, on the other side, or in the neighbor garden, as we say in Hebrew. But, like, for example, I put two things. My friend is taking a ranting for a pain, and I'm on Tegretol. Or my aunt is getting physical therapy for her walking, and she's not on Ampere. So I think it's important to remember you is you, and sometimes there's certain medication that patients do not tolerate, that is contraindicated in those patients, and I'll talk a bit about Ampere in a few minutes. But I think it's important to get the information and know the information and then see if it applies to your situation, so you can ask that. But sometimes what's fit another patient not always fits your symptoms or fits your disease. Okay, so fatigue is the first symptom. Of course, how can I not speak about fatigue? It's one of the most common symptoms in MS. About 90% of patients with multiple sclerosis have experienced at some point of their life having fatigue. So, as you can see, very, very common. Multitude of causes for fatigue. It could be the direct effect of the disease of MS. It could be medication that you are taking. So that's really important as well, or either other disorder. For example, thyroid abnormality can lead to fatigue. So really important really to make sure that you have a thorough assessment of your fatigue. That's the first step, to assess what's the cause. And look at all the illness, the things that affect you, and look, is it the medication? Is it other illnesses? If you have other illnesses. So first of all, the first step is assessment here. Then next, how do we manage fatigue? I think we're all very good consumer of coffee, either Starbucks or Dunkin' Donuts and all type of coffee. So I think as long as it's in moderation, it's probably a good treatment for fatigue. And we all do the same. So important to look at that and look at the consumption, especially, for example, if you have high blood pressure. So important to do things in moderations. Exercise, physical therapy, occupational therapy. I can't really emphasize enough, and I'm so happy that Dr. DeLuca showed some studies looking at exercise, because there is no questions it provides energy. Even though you may be tired during the exercise, exercise, but afterwards you have a better effect. I can tell you from my personal experience, our gym was closed because of the hurricane for 2-3 days. I was a different story, a different person completely. Dr. Lovin could attest to that. So I think exercise is really important. It channels out everything. So there's some medication, as you probably know, for fatigue. I'm not going to talk about them in length, but just mentioning their name. Some amantadine, Provigil, Nuvigil, antidepressants sometimes can cause. But again, sometimes you're tired because you're depressed. You need to address the depression, not the fatigue. So sometimes, again, the first step is identifying the cause for that fatigue. This is the next slides. I have some exercise pictures. I think the main things really, that's a big man. I don't know if I can do push-up like this for so many. But I think the main points that I would like to tell you, choose something you like to do and do it at a very low level, okay? Gradually go up. You can't do like 10 hours on the first day. Do a few minutes and then go up level. That's a key thing, really. And exercise, it's very hard to start in the beginning. So always I tell patients, really, please use something you like. You like biking, you like walking, whatever. Do it with the family, do it with, walk the dog, whatever you like to do, because otherwise you won't stick to it if you don't really like doing it. Walking. I think walking is also a very, very common symptoms in MS. About 80% of patients have walking difficulty in multiple sclerosis. And again, as you can see, we think about it as a simple task, but no, it's really not a simple task. You need your strength, you need your coordination, you need your sensation to be able, you need your vision, you need all your senses to really be able to walk. It's not, again, it's not a simple task. So what are the causes that can contribute to difficulty walking? As you can see, I mentioned few of them. Definitely if someone has spasticity, it can affect your walking. If the leg is rigid, it will affect your walking, no question about it. If you have weakness of one side or both, most of the time we see people with one-sided weakness or either decreased sensation, you don't feel the ground, that will affect your walking too. And that's why when we examine you, we check for all those senses, or either coordination issue, balance. So all these can contribute to difficulty walking, and perhaps that's why it's so common in multiple sclerosis, because you have MS. You have multiple symptoms sometimes in MS. So they looked, actually, I'd like to mention the NARCOM, and you have it's the North American research. It's a big, big registry, about 35,000 patient registry that surveyed patients with MS in North America. This study, on the side, the graph here, was done in 8,000 patients. And asking them and measuring, they asked to fill out some kind of an instrument about daily functioning, like doing the laundry, preparing meals, how difficult it is. And there was no question, the more mobility impairment, the higher here, as you can see, the ability to perform activity of daily living, that's what ADL definitely went down. So ambulation, so the ability to walk or inability, is definitely related to much more difficulty doing activity of daily livings. May affect your job, getting to the job, doing your job if you need to stand and walk a lot. If it's more of a sedentary job, it might not affect it. So it depends what you really do. How do we manage it? So again, the assessment, the gait assessment, how you walk, how long you can walk, and we work very well. I refer many patients to physical therapy and as well occupational, but physical therapy work more on ambulations, daily exercise. It's important when you go for physical therapy, you need to adopt, you need to do this exercise. It doesn't stop with that regimen that you went 3 times a week for 3 weeks and then you stop. You really need to learn to really incorporate it into your routine, because sometimes you lose lose the benefit when you go for just a period of time, and once it's done, it's done. I have many patients actually that pay privately for physical therapy because when they go for a longer period of time, it actually preserves their function. Actually, the National MS Society, I think, recently has won some big accomplishment in actually continuation of physical therapy for patients with MS, and who perhaps will be permitted to provide physical therapy for longer period of time. So this is very, very exciting. I think important to think about your safety when you walk, when you have a difficulty walking. I think sometimes you have resistance, which I understand, to use a cane or to use a walker or to transition sometimes for a longer period of time on a scooter, but sometimes for your safety, it's really important to do. As you can see, there is a new medication for the last about 2.5 years that has been approved. This is dalfampridine or Ampera. There are 2 studies that went for a short period of time, but they had some good results. As you can see, 43% of patients and 35 in 2 studies of persons showed improvement in their walk, as opposed to about 8% who improved with placebo. As you know, placebo sometimes is a very, very powerful medication. You can see it was in many, many studies because patients get the attention and you follow up and you get the therapy and you do it all in coordination. So, but as you can see, the last bullet here, the effect was pretty modest, 25%. I always tell patients to try it unless it's contraindicated. As you know, dalfampridine is contraindicated in patients with renal disease, kidney problems, or either patients that has history of seizures. Some patients on Ampera also had increased prevalence of urinary tract infection. It's something to watch for. So again, there is no medication without side effects. I guess we'll never have that. Even Tylenol has side effects. So I think what's important, if it's not contraindicated for you, try it for a period of time. The good things, you know immediately if it will be helpful for you or not. You try it for about 6 weeks. It didn't help. You just don't take it anymore because there is no sense of taking something that's not helpful for you. I've had some good experience with the medication, some not, but when it makes a difference, sometimes it can be a very simple improvement. However, patient will feel, for example, that it can pick up the leg in a much of an easier pattern or less effort, which is important. Whatever is the difference, if it makes a change for that patient, it's important to continue the medication. Next symptoms, quickly, how can I not talk about bowel and bladder after lunch? Again, so very common to have bladder issues in MS. About 80% or 85% of patients have bladder issues, and either they got to go, the urgency, or either the retention, which is the opposite. So important to drink water, important to always go to the bathroom when you need to, and I'm very guilty of that. I can stay all day without going to the bathroom, which is really unhealthy. So when you need to go, go. There's some medication to treat the urgency, not so much the retention. Sometimes you need to do some procedure to take the urine out. There is a new approval for Botox for bladder, very spastic bladder. You give injection, it's done by the urologist, of course, to relax that muscles. And some people get benefit from that. This is being done every 3 months. And then bowel, constipation or either incontinence, 2 different problem in MS. I think always think about how you can manage it with conservative methods, i.e. no medications. Think about the diet, think about fiber. One of my patients came one day and says, you know, the Fiber One bars really work very well. So here you go. Instead of doing medication, sometimes think out of the box. It's really, really important. Well, Dr. DeLuca did a wonderful job, so I'm going to pass that almost, but just think about sometimes that you are on medication that can contribute to cognitive dysfunction, so think about that. Stay physically active, mentally active, do all the puzzles that you can do, and definitely exercise. So, as you've seen, I chose few symptoms. Management is non-pharmacological and pharmacological. The main thing is education and communication with us as a team. important to prioritize your symptoms. We can't treat all your symptoms in one day, so we need as a team to choose the best one, the most important one to you, and what we think it's the most important one to treat on that day. Always first try non-pharmacological methods, and then medication always second or third or last choice. Non-pharmacological, we talk a lot about the other methods. What I really want to show you is this. Let me bring everything out. It's a nice idea that I've learned from one of our instructors in exercise. So as you can see, you need to be specific. You need to find a goal and write it down for you. You say, okay, this is my physical activity that I want to do, and choose something, again, that you like to do. Either it's dancing, Zumba is very popular today, if you can. If you can do something from your chair, it's okay, doing upper extremity, whatever you can do, or either walking if it's possible, or going outside. So I think it's important to manage one activity initially 2 or 3 times a week. It was shown that if you do something for a long day as versus doing one thing for a small period of time 3 times a week, it's much more beneficial. So break it down. You get the star if you choose something. Pharmacological, so a few points here. Try not to mix up some medication. That guy, I believe, mixed up Viagra and some hair growth medication, which is not a good idea sometimes. Or either on the bottom you have medication that modafinil, it's for fatigue again, and Ambien. So sometimes you take Provigil so late in the end, you're unable to sleep, and then you take Ambien. So try to identify those issues and discuss all the things. And sometimes you really have to do details here, really important. I mentioned the team, so you can see the patient and the family, whoever that family you define is in the center, and all of us are around. Not for nothing, I chose the nurses at the top of this theme, but that's okay. Hopefully my team will excuse that. Summary, MS symptoms are definitely the result of disease processes, the inflammation and the nerve damage that we see in MS. Symptom management definitely is an important component of your care, no questions about that, because we know that symptoms can result in that emotional issues, psychological and physical burden. And effective treatments definitely focusing on quality of life and preventing development of additional symptoms. Remember, we talked about primary and tertiary symptoms. And again, you are in the middle of all this team approach. Really, really important to focus on your symptoms and see how you can manage them in a more non-pharmacological first and then go next. Thank you so much.